Okay, thank you. So we now have the recording starting. So why don't we go ahead and get started with introductions. I'm Jessica Vega Peterson. I use she, her pronouns. I'm the Multnomah County Chair and the Chair of LPSCC. I'm going to be relying a lot on Abby today because my voice is almost non-existent at this point. Abby, I'm going to pass it over to you to run through the introductions if you would do that, please.
Sure, no problem. Good afternoon. Happy June, everybody. Good to see you all. My name is Abby Stamp. I use she, her pronouns, and I am the Executive Director of the Local Public Safety Coordinating Council, or LPSCC. And I'll introduce my colleague, Christina Yausi, who is running the show today. She works on the LPSCC team as well. Let's start with Jay.
Good afternoon, everybody. Jay Scroggin. I use he, him, his pronouns. I work with the Department of Community Justice, currently in the role of interim deputy director. For the purposes of today's presentation, I will have my adult division director hat on. Good to be here.
Fidel.
Hi, I'm Fidel Casino DeClue with the Federal Public Defender's Office for the District of Oregon. I use he, him pronouns.
Alicia.
Hey everyone, good afternoon. Alicia Temple, she, her pronouns. I am in the county chair's office, working on implementation of House Bill 4002, here for the presentation later.
Denise.
Good afternoon, everybody. My name is Denise Pena. I am the director of DCJ and I use she, her pronouns.
Aaron.
Good afternoon. My name is Aaron Knott. I'm the policy director for the Multnomah County District Attorney's Office. I use he, his pronouns.
Barb.
Hi, Barb Marcial, Trial Court Administrator for the Circuit Court here in Multnomah County. I also use she, her pronouns. Thank you.
Commissioner Gonzalez.
Commissioner Renee Gonzalez, City of Portland.
Amy Anderson.
Good day, everybody. It's so nice to see everyone's faces. I have been recently added to this committee as a community member. I am so excited to be doing this work. Basically, I've been involved with Multnomah County over 30 years as a volunteer chaplain and MCDC, and I currently hold a position on a forensic assertive community treatment team. And I do a whole lot in this community that a lot of you might remember me from. And I'm just here to learn from all of you and help in any way I can. Thank you for allowing me to join you.
Awesome.
What an awesome group of people.
It is good to see you, Amy.
Yes, yes.
Grant, over to you.
Good afternoon, Grant Hartley. I'm the Multnomah County Director for Metropolitan Public Defenders. I'm joining from vacation, so if my signal cuts out, I apologize. I might go off video.
Thanks, Grant. Stacy.
Good afternoon, everybody. My name is Stacy Redding. I use she, her pronouns, and I'm the Executive Director of Multnomah Defenders, Inc.
Sheriff.
Good afternoon, Nicole Morrissey O'Donnell, Multnomah County Sheriff.
Kyla.
Good afternoon. My name is Kyla Armstrong Romero. I use she, her, hers pronouns, and I'm the Juvenile Services Division Director in Multnomah County with the Department of Community Justice.
Natalie.
I'm Natalie White, United States Attorney.
Stephanie.
Hi, everyone. Stephanie Howard, Mayor Wheeler's Director of Community Safety.
Claire.
Hi there, Claire Pladel, she, hers. I'm with Disability Rights Oregon's Crime Survivor Project.
Commissioner Brim Edwards.
Good afternoon, everyone. Julia Brim Edwards, I'm Multnomah County Commissioner, District 3, which is primarily Southeast and a little piece of Northeast Portland. And I use she, her pronouns.
Morgan.
Hi, my name is Morgan Godwin. I use she, her pronouns. I am a community representative, and I also serve on the Measure 110 Oversight and Accountability Council.
Christina.
Hi, everyone. Christina McGovney, she, her pronouns with Volunteers of America, Oregon Home Free, serving survivors of domestic and sexual violence.
Chief Goldberg.
Hi, good afternoon, everyone. Chief Travis Goldberg, Gresham Police Department.
Counselor Jones Dixon.
Good afternoon, everyone. Councilor Jones Dixon, City of Gresham, and County Commissioner-elect. District 4 is here. Thank you.
Good afternoon. DA Schmidt.
Hey everybody, Mike Schmidt, Multnomah County District Attorney.
Rachel.
Hello, Rachel Banks, I use she, her, and hers. I'm the Director of Multnomah County Health Department.
Awesome. Chief Day.
Hi, Bob Day, Portland Police.
And Commissioner Myron. Commissioner Myron, can you hear me? That is Commissioner Sharon Myron, Multnomah County Commissioner from District 1. Chair, I think that is everybody. Back to you.
Okay, thank you so much, Abby, for running through that with everyone. I just wanted to take a couple minutes at this meeting to talk about some of the member changes that we have going on for LPSCC. So we've already heard from Amy Anderson, who is going to be joining this group as the Victim Services as the community member who is going to be taking the place of our outgoing community member, Megan Godwin. Megan, thank you so much for your service. It's been so great having you as a part of LPSCC. I've really appreciated your insights and your perspectives, both your lived experience and your very strong academic credentials that you've been bringing to all of the public safety issues that we've been talking about here at this table for the last several months. So just want to wish you the best of luck in what you're going and all of the work that you're going into the future on. And Amy, I wanted to provide a warm welcome to you to LPSCC, but I don't think it would be as warm as the greeting you gave all of us in your introduction. So thank you so much for being here. And then I do want to just acknowledge that we have a couple of folks whose terms are ending this month from our victim services teams. So we have Christina. Christina, thank you so much for your role, both the work that you do at VOA and the role that you've had here at LPSCC. And I want to say the same to Claire as well. Thanking you, both of you. We are in the process of adding new folks onto LPSCC to fill those roles, and we'll have more information about that going on. But I think the voice of victims services is going to be really important to continue to have as part of our conversation around community safety and public safety, and just appreciate the wisdom and insight you've brought to the LPSCC table in your time here. So thank you so much for your service. Abby, is there anything else you wanted to add to that?
I just want to appreciate everybody who continues to contribute their time and energy and love to this group. I know it is a big and unwieldy meeting to have once a month, and we try to have quite a variety of voices at the table. And Morgan, thank you for everything. I'm really excited for you and your opportunities. I'm really glad you're here today for this particular conversation. We're super stoked to have Amy back. I met Amy way back when I first got this job on the mental health subcommittee, and just Amy, thank you for your many decades of service to Multnomah County, and welcome to the LPSCC table. So stay tuned as we have been trying to solicit and recruit additional members. And Christina Yowsi is just such a champion in making sure that we cast a very wide net and make sure the folks who come to this table from different perspectives have the opportunity to apply and contribute their wisdom and expertise. So again, thank you for that. Chair, if there's nothing else, I will pivot us into our agenda for today.
I just wanted to make space to see if there are any partner updates or announcements that folks wanted to share before we jumped into the agenda items for today. So I want to open the floor up to everyone to share anything going on in your organization or your jurisdiction that you wanted to share with the LPSCC folks.
I can share. So for Volunteers of America Oregon Home Free and El Programa Unica, we are going to be bringing on 24 HUD housing placements specific to survivors of sex trafficking. So this is going to be a big first for our domestic and sexual violence continuum, and definitely intersects with the work of LPSCC and public safety and all of that. We're really, really excited to have these housing spots come online and 2 full-time staff members to support those survivors who get placed in those spots.
Thank you, Christina. That's really exciting news. Anyone else with any announcements?
I just want to bid farewell to everyone. That was already introduced so beautifully, but this has actually been a really amazing experience for me as a formerly incarcerated person to sit in the same room as the sheriff or the chief of police. It's just been really healing for me personally, and that we can sit down and have these dialogues, I think, is really healing for the community. But I am starting a PhD program studying substance use in San Diego. So I bid everyone farewell.
Thank you, Morgan. And we all wish you the best of luck with that study. Amy.
Yeah, I was just hoping I could ask Morgan a takeaway that she might leave us of things that maybe she feels might be undone, you know, that she would like to see completed. Sometimes people leave, I've noticed, and they have these plans and dreams that they really wish they could see completed. And so this team is so powerful. I was just wondering, as a community member, was there anything she would like to leave us as something that maybe we could carry the torch forward, you know, on your behalf?
Yeah.
That's kind of how I think.
Well,
Sorry.
the agenda today is specifically on Measure 110 things, which is something I've been involved in now for years, and I still serve on the OAC. So I'm going to take a brief rain check on that and maybe discuss it later.
That works. Thank you.
Thanks to both of you. Anyone else before we jump in? All right, Ab, I'm going to turn it over to you.
Great.
As we're going to jump in, we have a really broad discussion today on the House Bill 4002 public safety updates. This is a massive bill with massive impacts to our community. And so I really appreciate all the folks who are going to be part of this presentation to talk about the issue today. And I know we'll have a lot of conversation about it as we walk through this. So Abby, over to you.
Great. Thank you, Chair. So I first want to address Commissioner Gonzalez's questions. We do have a few slide decks that will be presented today. So that all of the materials and the recording for today will all be posted by tonight. We had a special request of our IT folks to get the recording process so we could get it up there. But we had decks coming in at end of last week and today, and so we just didn't have the time to turn them around to you all. And we will make sure that's available to all of you, members of the public as well. And before I jump in with my opening comments, I just want to remind all of the LPSCC members to see who is tuning in today. You're able to click on your attendee button on the bottom, and on the left-hand side is the panelists, which is all of the membership and presenters today at LPSCC. And then we have attendees, which is any of the member of the public or other interested parties who wanted to tune in and watch live. And it will, of course, be available later for watching. And to remind you all that if you have something to say and want your face to be seen by our attendees, please turn on your camera or at least introduce yourself if by the end and we're having discussion, you want to be able to do that so folks can recognize you. So thank you for that. So I have a couple of introductory comments, and then I'm going to hand the baton to Chief Day. So just as a level set for today, go ahead, Christine, I can go to the next. Thank you very much. Slide, just a brief overview. Our intent today is to do a high-level overview of House Bill 4002 and how it impacts each of our criminal justice partners. So we will have a bit of a background about the legislation, go over some of the new drug delivery charges and impacts on law enforcement, get updates from our chiefs and sheriff. Judge Greenlick will, I believe, is in court, but should be joining us shortly to talk about the new pretrial release update, which was recently completed and signed. Alicia will talk about some of the work for deflection and treatment readiness for individuals who have law enforcement contact with drugs on their person. And then Jay and Denise from the Department of Community Justice will talk about the impacts and interventions with community corrections or parole and probation. Next slide. Just a couple quick comments before I hand the talking over to Bob Day is just as a quick reminder for everybody who's tuning in today. Before Measure 110, which was passed in 2020, people who were arrested for standalone drug possession, along with drug possession accompanying any other charges, were arrested and booked and prosecuted as per usual. And at that time, there really was an acknowledgement that the criminal justice systems really perhaps should not be the primary response for folks who are struggling with a behavioral health disorder, which is a medical condition. And there was an acknowledgement that how can we as a community intervene and support folks who need treatment and medical care and services much more than a criminal justice intervention. Thus, the populace voted and passed Measure 110. And so in that, an attempt to decriminalize simple possession, to infuse funding into our behavioral health system to bolster treatment for substance use disorder conditions was attempted. And we all know that that rollout and implementation, all the way from the law enforcement citations to the availability of appropriate treatment, was challenging and did not have the intended impact. And just a side comment here, that was also before the incredible infiltration of illicit fentanyl into our community. So now here we are with House Bill 4002, and we have an incredible amount of opportunity to right size and make sure that folks who are struggling with substance use disorders have access to services, care, and treatment, and when appropriate, other interventions. So today we will have all of our criminal justice leadership who are involved in House Bill 4002 implementation, sharing on what we have worked on so far and the system-wide impacts of that legislation, from treatment readiness and pretrial detention changes to prosecution rates and prosecution changes, as well as impacts on our probation partners. So we have a lot to get through today, and I know there's a lot of interest. So the chair and I plan to usher us through each of the dimensions of House Bill 4002. And please know that there may be more questions and discussions than we have time for today. Any unanswered LPSCC member questions or public feedback or comments can also be submitted through a contact form that we have on the LPSCC webpage. It's been there a long time. And Alicia, when she gets to her presentation, will share that link so folks can grab it and submit any information that didn't get highlighted today or any unanswered questions. And just as a reminder, we will be posting this recording as well as any of the other materials. And my favor to our LPSCC colleagues, please jot down your questions. We want to make sure we get through all of the content today. And then we will make sure to have time for discussion and questions as soon as we get through that content. And then we will be moving on to our next obligations for the day. So those are my opening comments. What I would love for Christina to do is to stop screen sharing, and I will hand the agenda over to our law enforcement partners, starting with Chief Day, then to the sheriff and to Aaron Knott from the DA's office. But let's start with Chief Day.
Well, thanks, Abby. Great overview. Good afternoon, everyone. Thanks, Bob Day with the Police Bureau. So a couple of things, both that PPB is doing specifically and then around the areas of enforcement since House Bill 4002 passed. So we increased our bike patrols on afternoons. So we now have 4 bikes on afternoons as well as bikes during the daytime. We find those to be most useful to addressing street level drug dealing and anticipation of an increased expectation of contacts in September. Wanted to get the bike squad up and rolling both on afternoons and on days. So we're doing more contacts, more outreach. Those bike officers are working with behavioral health specialists, trying to continue the cooperation between both enforcement and services to the best of our ability. We also strengthened our investigative unit around overdose deaths. So we added 2 more detectives and a sergeant, and we now have 4 detectives focusing full time on the investigation related to overdose deaths. And then we added a couple of officers to our interdiction team. So we're back to taking a more robust effort to focus on drug trafficking organizations and higher level delivery systems within our community. So really proud of the Portland Police Bureau response to kind of a holistic from the street all the way to, you know, the organized groups that are really causing this harm to our community. As it relates to the passage of the the legislation. As we know, the ability to arrest for unclassified misdemeanor for possession goes into effect September 1st. But one of the areas that went into effect immediately was around delivery. And to just keep it as simple as possible, there were some requirements prior to 4002 that made reaching the probable cause for delivery at a much higher level. And after the changes, we were able to make some delivery cases as it relates to, the amount of possession, having a scale, money, other factors that go into delivery where the person may not have actually made a sale. And out of that, we've made about 12 to 15 cases now through that new change in the law. As we're getting used to it, work very closely with DA Schmidt and with his office, and always appreciate their counsel and information. And then, obviously, we keep Natalie's office in the loop as well in terms of, the potential for cases. We continue to issue citations for Measure 110 violations. And as of the first of the year, we're a little over 400. I don't know that that's going to be an accurate number to draw from, in terms of a lot of people are understandably curious as to what is going to be the likelihood of people back encountering the criminal justice system at a higher level on September 1st. So I can tell you since the first of the year, a little over 400 citations. Last year, for the majority of the year, we were somewhere north of 700. So, but because of the fact that the people that are going to be able to do the collection will be just possession only, I don't know how many of these citations might have had other accompanying charges with them. And so it's really hard to kind of give you an estimate of what we think we're going to see. But 400 is no small amount for Measure 110 citations since the first of the year. And we will continue to use that resource until September 1st, which then will switch to an enforcement deflection combination. So that's what we're at right now. Of course, a lot of this is downtown centric, but we recognize that it impacts the entire city of Portland, the county, and really the whole state. But for our purposes, most of what we're seeing is in the downtown core, but it will apply citywide, obviously, and we'll use these other units to support that interdiction effort. So that's what I have, and I'm happy to take any questions, and also can pass it off to the chief or sheriff, whoever wants to go next, Travis or Nicole. But any questions? Commissioner, hands up.
Hi. Yes, I don't know if you can hear me, but I was just curious, out of the number of citations, what outcomes have there been for those? Like what has been the result of issuing those citations?
Yeah, we haven't tracked that, Commissioner. I know that historically, we haven't seen great, responses, varying inputs from officers, as well as those that have received the citation in terms of the availability and the accessibility of people on the other end of the line when calls are made, but we haven't tracked that specifically. I can, dig into a little bit, see how many of those are repeat offenders and et cetera. I didn't bring that information, but I'm happy to try and track that down if it's available.
Great. Thank you.
Thank you. Amy, I see your hands up.
Yeah, just a quick question on if an individual gets a citation and doesn't show up, will it turn into a failure to appear?
Under the current Measure 110 guidelines, I'm going to say no, but I'm also going to make sure DA Schmidt can affirm that.
Because that is becoming more of an issue than anything, is the continuous cycling of I didn't show up to court.
Yeah, it's definitely something we have to be aware of, is the likelihood of the potential increased failure to appear warrants and the impact that might have on either the jail or the courts.
Yeah, thank you. That's what I was wondering, because that becomes a multiplication number super big over time.
Great. Thank you, Chief. Appreciate it. Next on our list is Sheriff.
Thank you. Good afternoon, and thank you, Chief Dave, for that update. That was fairly comprehensive, and I think I'm going to focus on what is occurring in our jail system because I think it's really important to see our population trends over time, providing a baseline as we continue to move forward with multiple upcoming changes to our system. Just for everyone's awareness, we publish this report monthly, and it is on our website if you would like to continue to track that. So overall, our bookings into our jail are continuing to increase. Last month, we booked 1,561 individuals into our custody, and that is about 13% higher than May of last year. Last month, the average daily population was about 940. As a reminder, we are currently budgeted for a capacity of 1,130 jail beds. And that is also 6.7% higher than last year at this time. Given that increase, last year or even in January, we were at about 77% of our budgeted capacity, and we've continued to increase. This weekend, we were at about 85% of our budgeted capacity, and we've been sitting between 80 and 83% of our budgeted capacity. So we are continuing to see increases there. And then just to give you an idea of the composition of individuals in our custody, 65% of those are pretrial. They're awaiting adjudication. 73% were booked on at least one felony charge, and 37% had at least one ballot measure 11 charge. Our population of individuals that are being held over 30 days or longer continues to rise. The average length of stay has been between about 15 to 18 days over the last few months. Prior to COVID, it was around 11 days. And then just to also level set, keeping in mind that our population is based on a number of factors, from the policies and practices of our law enforcement partners, court processes, and length of time for adjudication. Obviously, some of the changes that we're seeing and going to see through the Chief Justice order, the presiding judge's order, around release decisions, 4002 deflection and treatment engagement, prosecution changes around possession and recriminalization. We're always in the process of monitoring because we've had a lot of changes over the last few years. So we'll continue to monitor our population, determine what is driving the increases and the impacts of other processes and the trends. And so what we can expect is we're going to continue to monitor. It has gradually increased over the last year. I expect it to continue to have some increase, but that will also remain dependent on a number of factors that I just discussed. We will always keep our stakeholders and our partners informed through our regular reporting mechanisms. And in the past, we've put small groups together to ensure that we're getting more regular updates when we've needed to keep a closer eye on our population. With that, those are the updates I have with respect to what potential impacts for our corrections facilities, and I'm happy to answer any questions.
Sheriff, thank you. Appreciate it. We're gonna, it's gonna be hard, but we're gonna try to pause on questions. So just write down who your question's for, what the question is. Just want to make sure we get through because there are so many components of this legislation we want to make sure we put into this space today. Sheriff, thank you. Really appreciate it. We're gonna move over to Aaron Knott.
All right, thank you, Abby. Again, Aaron Knott, I'm the Policy Director for the Multnomah County District Attorney's Office, and we did bring in a brief slideshow, which I hope everyone can see okay. And Christine, thanks for your help with this. So it's too early by far for us to actually start getting into what the specific effects of the aspects of 4002 relating to drug dealing have had on our office. They went into effect about 2.5 months ago. But I wanted to seize the opportunity to provide you with a snapshot of what's been going on with drug distribution cases more generally in our office over time and what we're forecasting for the future. Just as a reminder, there were 2 changes in House Bill 4002 relating to drug distribution that were very high priorities of our office. The first one was the restoration of what is commonly called a Boyd delivery, or basically possession with the intent to deliver. And then the legislature also created some new zones in which the penalty for drug dealing is heightened, being in or adjacent to a treatment facility, transitional housing, or a park. We don't track these discreetly as of now in our system. They're what are known as enhancement factors, so they're very hard for us to pull. But even if we did, it's far too soon for any of those new cases to have gone to adjudication yet. So I can't tell you anything about what a sentence would look like or what those outcomes are. That takes much longer than 2 months. So next slide, please. So what we are trying to capture for you is just a brief snapshot of what we've seen over time with the crime of distributing a controlled substance. This first one breaks it down, all crimes, all regions, all permutations of DCS. So methamphetamine, fentanyl, cocaine, heroin, all at once. Also all parts of the county. So this is PPB, this is Gresham, this is MCSO, this is everything that comes through our door. I want to throw out one caveat because it's going to come up over and over again. Our data, our projection data for 2024, the way we do that is basically we look at what we run our data quarterly. And so we're in the second quarter now. We haven't completed it, so I don't have second quarter data. That also means I don't have data for post 4002 because it went into effect in April. So all we're doing here is taking what we saw in quarter number 1 and sort of forecasting that trend line out. So I want to be very clear with you that it's likely that it is lower than it will actually be when the legislation kicks in. That's just how our data runs. So I want to be very clear. I think the projections are probably below where they will end up. So you'll see a dip, significant dip during the pandemic, but I want to emphasize that it wasn't just the pandemic. There was the pandemic. There was also ballot measure 110, which changed enforcement strategies. And there were multiple changes in appellate law that made the prosecution of distribution of a controlled substance more difficult. The most famous of those was the change to Boyd deliveries known as Hubble, but there were other ones that our prosecutors would tell you made a difference relating to vehicle stops and other tools that law enforcement can or cannot use in a drug investigation. Next slide, please. So this is our quarterly case referral rate. So this is how many cases are referred to us, come through the door from law enforcement for distribution of a controlled substance. You'll see that they've been trending steadily down since 2014, and the gap from 2014 to 2020 is pretty significant, going all the way down from roughly 235 cases being referred per quarter, all the way down to, at the start of the pandemic, dropping all the way below 40. We have since gone back up to around 80, which is, we're seeing rates that are starting to creep up to about equivalent to immediately pre-pandemic. But again, it had come down a lot before then. And some of that, once again, comes back to appellate law decisions, not to ballot measure 110 or to the pandemic. Next slide. All right, so this shows our case issuance rate, and this means prosecutors evaluate a case as referred by law enforcement and determine whether or not they think they can proceed. And with distribution of a controlled substance, there are a lot of legal issues related to search and seizure that go into that question, so it can be tremendously impacted by changes in case law. During the pandemic, we saw a drastic decrease in almost every type of case issued for the simple fact that the courthouse was closed, which tremendously complicated our ability to issue and prosecute cases over the duration of the pandemic. But again, and I know it's repetitive, there were also appellate changes that made it particularly difficult for us to prosecute distribution of a controlled substance. However, since the conclusion of the pandemic, our issuance rates have rebounded to an all-time high in 2023, at least within the range of time for which we have data. And in 2024, so far, we have seen something very consistent with historic averages going back well before the pandemic. Next slide, please. So this is interesting. I think this really drives something important home, which is I just broke out methamphetamine and fentanyl. We can break out cocaine, we can break out heroin, we can break out, other less frequently encountered crimes like MDMA, but these are really the big two. And I think it's sort of a bracing moment to realize that prior to 2021, you really didn't see prosecutions for fentanyl because it wasn't in the criminal code. It was introduced in the criminal code by the bill that implemented ballot measure 110, which was Senate Bill 755. Gives you a sense of how fast fentanyl hit. You know, going from the moment where we were still at the legislature talking about what is this new substance to it becoming the lead problem in Oregon has really only taken a few years. At the same time, methamphetamine DCS referrals are about as low as we've ever seen them and have not rebounded as fast to go back to historic levels, probably because of displacement by fentanyl. Next slide, please. All right, percentage of referred fentanyl and methamphetamine cases issued. This is the same game as before. This is the prosecution side of proceeding with a case. For both fentanyl and methamphetamine, we are operating on the, well, for fentanyl, there is no historic average. We only have data for the last 3 years, but for methamphetamine, we are on the high side of historic averages, and for fentanyl, we are on the high side of historic averages for the crime of distribution of a controlled substance generally. Next slide, if I have another one. Can't remember. Christina, is that my last one or do I have one more?
That's the last one, sorry.
Okay, well, before I go, there is another point I want to make because, you know, we get a lot of questions about what's going on with these cases. And again, for the cases that are most at issue right now, the ones that were modified by ballot measure 4002, all I can tell you is, did we issue them and what's happened immediately following that prosecution decision? So we looked at 67 cases, DCS cases, and we did this off a spreadsheet. We didn't get to the point of a hand poll, but what that spreadsheet data suggested to us is that of the last 67 DCS cases that we have received, a full 45 have been postponed or dismissed for lack of a public defender. There is no challenge to prosecution that comes anywhere near the shortage of public defenders. While we do see a smaller percentage sometimes failing to appear out of recog and then not showing up at arraignment, 10 out of the 67 of the sample size I reviewed, that pales in comparison to 45 being postponed for lack of a public defender. To put it another way, of the last 67 distribution cases that have been referred to us, we have been able to do our work on about 12. I would submit that is an unacceptable percentage, but that is what we are looking at right now. I just wanted to make sure everybody heard what is causing those cases to be delayed. So that ends my presentation, and thank you for your time.
Aaron, thank you. Thanks for being here. Thanks for showing your data. We're going to keep on moving. Judge Greenlick, thank you for joining us, and thanks for getting some slides put together. Christine is going to present them for you. We'd love to hear about your updated pretrial release order.
You bet. Good afternoon, folks. We can go to the first slide. So part of House Bill 4002 was to required the Chief Justice to reevaluate her release guidelines, which then dictate in large part what our pretrial release order says. I want to just keep in mind that there was Senate Bill 48 from about 3 years ago, which required us to reevaluate initial release decisions and have release not depend so much on posting security. So we always had a recog office that would, when a case would come in, the recog office would make certain decisions about releasing person before their arraignment or first appearance. But Senate Bill 48 drastically increased the extent to which we would release people before their first appearance in court. And I just want to reiterate, everything I'm talking about is not, it doesn't say that they're released until trial or till some other major part of the case. It's just, are they held until their very first appearance, or are they released until their very first appearance? And that it typically is anywhere from 1 to 3.5 days, depending on what day of the week they are released or they are arrested. So the Chief Justice order sets these release guidelines 1, 2, and 3. If the type of offense is a release guideline 1, then you're released on recognizance. If it's release guideline 2, then you could be released on certain conditions, including reporting to like close street supervision or pretrial release supervision. And if you're release guideline 3, it's held for arraignment. Again, that very first court appearance. And then once you make that first court appearance, then a judge will apply other statutory criteria, balance a variety of factors, and determine whether the person should be released pending trial, released on conditions pending trial, or held on security, at which point they'll be held unless the person can post security. Roughly speaking, you're released on recognizance if it is a non-person misdemeanor or felony, except for Class A felonies are always a release guideline 3. It's released on conditions. Certain things like DUIs and person misdemeanors are released on conditions, and then hold for arraignment are all person felonies and Class A felonies. Now, House Bill 4002 required that the Chief Justice, I think we can, oh no, it's in that first bullet point. The Chief Justice was supposed to reevaluate our release guidelines when it came for folks that were being arrested for delivery or manufacturing of controlled substances. Next slide. Now, although the release guidelines are set by the Chief Justice in terms of these different categories, we are, as a presiding court, or as our court in the form of a presiding order, allowed to adopt overriding circumstances, which can move cases from release guideline 1 or 2 all the way up to 3, and can also, in certain circumstances, reduce the release guideline from 3 down to 2, but those are much more limited circumstances. The Chief Justice asked us to consider under what circumstances we should basically hold people charged with delivery of certain offenses or manufacture offenses. What we decided to do in this jurisdiction, which is consistent with the guidance we got from the Chief Justice, was we decided to hold everyone charged with delivery or manufacture of fentanyl. So even small amounts of delivery of fentanyl need to be held to see a judge. We also decided that for all offenses, non-fentanyl offenses, if the offense involves substantial quantities or a commercial drug offense, those are statutorily defined terms. Substantial quantities essentially is the amount, the weight, depending on the type of offense. So if they're charged with substantial quantities or commercial drug offenses, they need to be held for arraignment. So we've adopted an overriding circumstance which moved those cases up to release guideline 3. We felt like that was important, and it was consistent with what the Chief Justice determined, is that people that basically are looking at going to prison, which are substantial quantity commercial drug offense type cases, that those should be held for a judge to make the decision. We also understand in our community that repeat offenders for unauthorized use of a motor vehicle, burglary in the 2nd degree, and possession of a stolen motor vehicle is a significant problem in the community right now, especially with repeat offenders. So given that those offenses are all typically release guideline 1 because they're non-person felonies, if the person is booked on a case after having been previously convicted, then it'll move it to release guideline 3, and they'll be held to see a judge. Also, there's a variety of, I'm just sort of highlighting a few changes, but this is one: if the person makes a clear and unequivocal threat to cause harm, that gets bumped to release guideline 3, no matter what the guideline was originally. Next slide. We've also had a significant problem. You'll see from some data we have soon in the next slide, with people failing to appear. At one point, I think last year, 44% of our pending misdemeanor cases were in failure to appear status. And a significant number of people get released by our recog office and only have a court appearance the next day and fail to appear in court the next day. This is for a variety of reasons. I don't know all of them. We haven't studied it, but I imagine it's because of a significant increase in the people that are dealing with substance use disorder when it comes to fentanyl and other drugs, and the houseless issue and the mental health crisis, behavioral health crisis we're in right now. But a lot of people can't or won't come to court, and they'll fail to appear repeatedly. So if somebody is booked in a new case and has 5 failure to appears historically anywhere in the state on any other case in the last 3 years, we hold them. If they are booked into custody on a failure to, let's say they're released on a felony or a person misdemeanor and they fail to appear for court, a warrant goes out, they're picked up again, those people are held to see a judge. In the past, they would just be released again before seeing a judge. If we have an exception for unrepresented people who don't have a lawyer, we'll let those cases slide until they've failed to appear 2 or more times because they don't have a lawyer and their case isn't going forward anyway. And also, if you're booked into custody on a misdemeanor case and you have 2 or more failure to appears on that pending case, you will be held to see a judge. Next slide. This is some of our failure to appear data. You'll see that we people released in the released by the RECOG office just had court sometimes the very next day. 24% were failing to appear, misdemeanors 30%. JC4 is our misdemeanor cases, and 34% are failing to appear. So we're trying to take a dent out of that. People need to be held. We understand that there are all sorts of reasons why folks aren't coming to court. Many of them are, quite frankly, very sympathetic and relate to mitigating circumstances in those folks' lives. But at some point, judges are supposed to be making release decisions, primarily on, are they going to reoffend? Are they going to come to court? And if you can't set conditions that will assure a judge that they're going to come to court, then they need to be held on security. So I think that's all I have. Judge Matarazzo signed the presiding judge order. It's 25 pages. There's a lot more detail. I just picked out some of the highlights, especially as it relates to drug offenses. She signed it on Friday. We're going to be distributing those to all our system partners if we haven't done so already. And some of the changes that are going to cause a significant increase in the number of people being held in jail, we're going to hold. Those won't go into effect until January 1st because we understand the sheriff needs to do planning. We're also going to have to open another arraignment court. This is going to be a significant increase in the number of folks in custody at our arraignment court. And ultimately, I imagine a significant increase in the number of cases that judges ultimately determine need to be held pending trial. So we need to talk about sort of putting together a more robust system of finding ways for people to become stable in the community so they can ultimately be released. But at this point, to a large extent, those don't exist. And the answer from the court's perspective is to weigh the factors we're supposed to weigh and make a decision. And I anticipate there'll be many more people held in custody pending trial in the upcoming months.
Judge, thank you. Thank you for sharing. Thank you for putting together a nice consolidated information. If there is any way that you would like the LPSCC web resource to be a place to house any of the court's information, just let us know. We're happy to do that, or link to the CJO or the PJO or the PRO. Great, thank you. We're going to keep cruising. Next is Alicia.
Thank you, Abby. Hi, everyone. Good afternoon. I am Alicia Temple. I'm the policy advisor for the implementation of House Bill 4002 here in Chair Jessica Vega Peters' office. Is Stephanie, I'm going to have Stephanie introduce herself as well. She is joining me to help answer questions and be a part of this too.
Hi again, Stephanie Howard with the Mayor's Office for the City of Portland.
Thanks, Stephanie. So we have some slides that we'll go through. I'm pleased to provide a progress report today on the implementation work that has been happening on House Bill 4002. As we all know, the bill was broadly passed with all of these different sections in it to reduce the public drug use and overdoses and improve quality of life for all of us here in the state. And we are, I think, very eager to get it implemented here in Multnomah County as well. So the bill goes into effect specific to small amounts of drugs being a new crime effective September 1st. And we are sprinting to get ourselves to September 1st and have a program up and running. House Bill 4002, in addition to that new crime, also created the framework and funding for deflection and encourages regions to create a program. So I wanted to put up on a slide what the specific definition of deflection is, since it is a specific public safety concept, but doesn't always translate to behavioral health or to other policy areas as well. So per the legislation, deflection is a collaborative program between law enforcement agencies and behavioral health entities that assists individuals who may have substance use disorder, another behavioral health disorder, or co-occurring disorders to create community-based pathways to treatment, recovery support services, housing, case management, or other services. So it is a broad definition that is broadly about connecting people between our law enforcement systems and our behavioral health systems. Christine, if you could take us to the next slide. The legislation also has a handful of specific requirements in the program setup, so in how folks submit their program to the Criminal Justice Commission. So it must be coordinated between the district attorney, law enforcement agency, community mental health program, and a provider from the Behavioral Health Resource Network, or BURNS. It must define who is eligible for the program and what qualifies as a successful outcome, be culturally and linguistically responsive, trauma-informed, and evidence-based, have a plan for language access, be coordinated by the CMHP or in coordination with the CMHP, and have a plan for ongoing communications between systems. So this is the framework, and answering these questions are what we have been using to guide how we set up this program and the collaborative work we've been doing with our partners. I think next slide. Yeah, thank you. I also wanted to talk briefly about the funding that is a part of this as well. The legislature directed $25 million to Multnomah County as one-time funds to support the construction of a behavioral health drop-off center. In addition, the program will include $1.9 million in funding from the city that goes along with that project. Additionally, there's $9.8 million that went statewide to community mental health programs, or CMHPs, for a specific service element that is called jail diversion, but as many of the behavioral health services that is divided between all 36 counties. And then in addition, there is the CJC Impacts Grant for deflection. That funding is via a formula, and we know that 3.8 million of it has been allocated to Multnomah County. We submitted the initial short form grant application back in April, and the next round of it, for lack of a better phrase, is due on July 1st. So we are looking at, for that 25 million, the legislature specifically included that for a drop-off center where individuals struggling with addiction can get referrals to treatment services. And that is part of a longer phased approach that we are taking to this work that we'll talk about in a minute. As we've been talking about, House Bill 4002 includes a variety of mechanisms to address public safety concerns around drugs and drug dealing, and they're all important parts of the landscape for how we will make our communities safer. The objective of this very specific program, and of deflection, as it's called in the legislation, is to connect individuals who would otherwise be arrested for possession of a controlled substance to a behavioral health pathway and recovery. So that is the goal we are holding as we move forward in this work. Now, the plan, as we are working on it, the framework for it has been developed in collaboration with regional law enforcement partners, including from the Sheriff's Office, the City of Portland and Gresham, the District Attorney's Office, and our work ensures that law enforcement can intervene when they see drugs or drug use, that they can seize drugs, and if there is no other criminal behavior, that they can connect an individual directly to treatment. We are planning for this program, knowing that the timeline is incredibly quick. What is possible on September 1st is phase 1, and we and our partners have committed to continually evaluating and improving the process and the connection to recovery and services. We, I think hope to very soon after September 1 be able to grow into providing additional services and broader networks, and that is a timeline and a process that we are working on. I think next slide, Christina. Thank you. So to have these conversations and to have a framework for the collaboration about this work, we have created a House Bill 4002 leadership team. This team includes, and I'm not going to list everybody, but you see it here on your screen, representative from the chair's office and the mayor's office, district attorney, chief day, sheriff, and others from the court system, public defense, and our behavioral health partners, both from within the county, but also some of our burn providers, to really make sure that we have folks who are doing some of this behavioral health work on the ground right now as part of it. And I also, we are adding to this group Chief Goldberg, who has some more time capacity than he did about a month ago, and is excited to join the conversation. And DA-elect Nathan Vasquez will also be joining these conversations. Next slide. So in addition, that group is really talking about the larger framework of deflection and treatment readiness. And then we have operations teams that are made up of people from all the different systems that are involved who are helping to map out how that will work. So step by step, when law enforcement has their encounter with an individual, what information do they already have available to them? Is it the right ones to determine if somebody is eligible or not? For example, is that person, obviously, if they have a warrant, they would not be eligible for deflection or some of those other pieces. So how is that going to work on the ground? And then how is the connection either to the drop-off facility or another pathway to deflection? How will that work out? It's also where we're having conversations about some of the other legislative requirements, such as if it's linguistically specific and culturally specific, and how to incorporate that at every level of this process. So I think next slide. Yes, thank you. So for us, for this program, successful implementation means that the new drop-off center will operate effectively for law enforcement. Will the process be easy to use and seamless? Do we have the right accountability mechanisms to motivate individuals to get the treatment they need to recover? Are eligible individuals successful in getting treatment rather than jail? And these are the questions that this group, both the leadership and the operations tables, are focused on, and that we are asking ourselves to get to September 1st. As a major first step, we are really pleased that we've made good progress towards having a facility for September 1. We are in final stages of negotiations on a lease for that facility. And the center will serve as a 24-hour-a-day, 7 days a week resource for law enforcement professionals to drop off individuals and connect them with treatment. And then additionally, county staff are currently soliciting bids for providers to staff and support this work at the drop-off center. So it is all moving along very quickly. Next slide. Thanks. The Readiness Center is part of the community's behavioral health continuum of care that includes recovery housing, transitional housing, detox services, and withdrawal services. Private providers are expanding treatment and services all the time, and there's a lot of new capacity opening up this summer and into next year that we are excited to be partnering with as we grow what services we connect individuals to. The county will also be opening a new sobering center soon as part of phase 3, where the law enforcement drop-off will be co-located in that longer term facility. So just to go through the phases, phase 1 is September 1st. It's that law enforcement will have multiple pathways to choose from to connect somebody to services. That could include a peer worker arriving on site with or connection to recovery services at the Treatment Readiness Center. Phase 2, we will add services on site at that treatment readiness center that incorporates feedback from partners and participants about how to better make that connection to services, and also including sobering and withdrawal management. And then phase 3 is when we move into a permanent facility with sobering and other services provided and co-located with law enforcement drop-off. So for next steps, what we know is that building out our behavioral health system is essential to reducing poverty, saving lives, keeping our communities safe. That way we can improve our county for everyone who calls this place home. We are moving, I just keep saying, moving forward quickly to get to September 1. The leadership team continues to meet. We are meeting again this week in advance of submitting the grant application to the Criminal Justice Commission on July 1st. The operations teams have broken out into sub-teams, and they are meeting to map out the programs so that we can work through all of the details to really fill out the framework beyond the proposal as it currently is. We also have a county board briefing on July 11th to share more information about where we're at and how the program is developing. And Abby mentioned earlier in kickoff that there is a link here. If you have questions or comments, go ahead and write down this link. And if we don't end up getting to all of them at the end, it is an opportunity to submit information afterwards. I just feel like I gave so much information in that overview. Stephanie, do you have anything that you want to add, or do you want to wait till questions at the end?
I think the only thing I would add is just that it's been really clear in the leadership team meetings that I think we're all interested in making sure that we are adjusting as we go forward. And so the September 1st version will grow very quickly. And I think we're all very much looking forward to having a more complete set of services available to folks. And we just recognize that we need to start somewhere. And so this is the first step in a longer journey that I think will yield some strong results for folks over time.
Great. Thank you both. And last but not least, before we open it up for questions and discussion, Director Pena.
Thank you, Abby. Again, good afternoon, everybody. Denise Pena with DCJ. So we expect to start seeing the cases from either failed deflection or for those that opted not to participate in deflection by January onto our caseloads here at DCJ. But regardless, we're going to be ready and prepared by September 1st. And now I'm going to pass it on to Jay, who will talk about what this is going to look like in our Adult Services Division.
Thank you, Denise. So yeah, beginning September 1, we'll be ready to go on this. Just to remind folks, we have supervised conditional discharges before, and of course, we've had a long history of supervising misdemeanor probations before. It starts with training. There's a few details that are still being worked out as to forms and processes and sanction grids by the state of Oregon right now, which should be done maybe in the next 3 weeks. When that is done, our plan is to train every officer about the ins and outs of both conditional discharges and misdemeanor supervision under the 4002 group. When these people come onto our caseloads, what we envision is they would be sorted, and they would be sorted by that crime type. If the person is coming onto supervision, either for conditional discharge, which is a 12-month supervision, or for the unclassified misdemeanor, which is an 18-month supervision, they would be, if the case is a standalone 4002 possession of controlled substance case, it would go to one of 4 specialty POs who would only have those cases located both geographically within our East and West generic caseloads. If the person comes to supervision and they are already on supervision to us for a funded felony or misdemeanor case, they will stay with the PO who they have. Hence the reason that everyone needs to be trained on how to do this so that they know how to treat these cases compared to their others. We believe that by maintaining their existing PO, you have the continuity of services both in relationship, but also in the expectations of maybe prior case planning that's already been going on. People are going to come onto our caseloads. Our main priority is similar to deflection. Get them referred and engaged in treatment. or programming in the community as soon as possible, and hopefully get to a point where they are getting off of that. We are committed that every one of these cases will see field supervision and not go to a case bank where really we're only responding to any more law enforcement contact. We have low-level supervision within the county now, but there's no casework going on with them. That's to manage our resources. We want all these people to get field supervision so that we can follow through with, again, the referring to treatment and the following through and possibly responding when there's violations going on. We think that that's a commitment both to the state and our local community justice partners. We will still continue to keep the risk score. We will do a public safety checklist, which is the state approved risk score of how we sort cases in the state of Oregon. So even though someone might have a low risk score, they will be still on these field supervision caseloads and follow the expectations that I've outlined. Our main objective is to get these people to a point of early termination or earned discharge. Those are two different things. For the conditional discharge population, we are hoping that they get engaged in treatment, get to a point of halfway where they are done, and we will then do an early termination. Early termination is where we have to ask the judge that had to have this person enter early. The other group, the people who are on the misdemeanor supervision, they qualify under existing Oregon law for earned discharge, meaning at the halfway point, if they've engaged and have been doing things within their case plan, they can actually just terminate early, done by us, and we notify the courts of that happening. That's our goal, is to get to both of those places so that we can both manage our resources, but that's the level of success that we are looking for. We are going to engage in a lot of data tracking. There's a lot of data that DCJ tracks. It's pretty easy. How many people come in, how many people get revoked, how many people are earned discharges. We also, though, want to take that a step further. We would like to be working from now until September with our partners. How do we define success for some of these other things? How many people came to us who needed housing and they left with housing? How many people came to us who needed a job and they left with it? How many people came to us, got engaged with treatment, but maybe there were some other things going on there? So as we define success, that's going to be some of the work that we're going to do from now until then. But initially, we should have just those basic things: how many people come in, how many people are either revoked or successfully complete. We've been doing that before. We'll be able to do that in the future. And then lastly, we're going to be working with the courts, or lastly for me, we're going to be working with the courts on ensuring that when they go back to the court on a success, meaning an expiration, an early termination, or an earned discharge, what is the mechanism to let the courts know to start the 90-day timeline for them to push the person to that expungement process? I'm going to follow up a little bit with that later on, but that's our goal, is to be working with certainly Judge Greenlick and Barb as to what that closing summary looks like moving forward. Denise, I'm going to get back to you.
Yeah, thanks, Jay. And then again, we're also been participating in regular meetings around planning implementation groups, and Alicia just got done listing out some of those. I sit on the executive team. We have John McVeigh, who is a senior manager here at DCJ, as well as Nate Roberts, who is a community justice manager at East. They're part of the operational team. And then we've just been having our all internal county meetings, and we've been recently meeting with Alicia as well to make sure that DCJ is helping move this work forward. And then John McVeigh will be representing DCJ on the planning and implementation for the deflection center.
Thank you, Denise. Thank you, Denise. A couple things just to update from the state of Oregon. Just had a meeting a couple days ago. The Department of Corrections, that is in charge of kind of all of our forms and things, they are in the process of working with the Oregon Judicial Department on the closing summary. I believe that that is done and just needs to get through some of the Oregon Judicial Department approvals. Like I said, that's going to go into effect so that that can trigger the courts to know, start the process for whether you would like to consider this person for expungement or not. The Department of Corrections is updating their sanction response grid. When someone violates the term of supervision, DCJ uses a grid: violation, this versus risk, and what the options are for a PO. That is going to be modified to take into count this population. We think that specifically the sanctioned responses should be very mindful and not include a whole bunch of go to jail when you use controlled substances. It should be for some of these other things to, again, push us towards success. So we're waiting for that to be done. Should be in about 3 weeks on that. And like Judge Greenlick reported, we are working with the courts, the DA, and the defense on the process of our pretrial system. DCJ has a recog and pretrial book of business that will be certainly processing some of these folks moving forward.
Thanks, Jay. The other thing I would add is that even though we're focusing right now on what supervision would look like for these individuals, we do have our Juvenile Justice Services Division here at DCJ. And so I know that we're starting to have the conversations with our juvenile justice stakeholders, such as the courts and the DA's office, about how any impacts this might be to those under the age of 18. And that's all we had, Abby.
Great. Chair, did you want to add anything?
Oh, I was just, assuming that DCJ was all done with their presentation, and I wanted to move this along to make sure we had time for questions. I know that there were some in the chats and some that I'm sure people have. If you want to use their raise hand function to do that, that's fine. I will address one. One thing that I do want to say is that and I think you've heard this in the different presentations that folks have been giving today, is that while we're doing our best to anticipate what the impacts of House Bill 4002 implementation will be, either the parts of those of the bill that have already gone into effect or the parts that are going to go into effect September 1st, we don't know everything at this point, and so. For me, that means two important things. One, that we have to be ready and be nimble to be able to respond to those effects, which is why we put $2 million in my budget, for instance, that the board passed just a couple weeks ago, specifically for House Bill 4002 needs, whether it's additional jail beds, whether it's additional capacity in DCJ, looking at what those potential impacts might be, and having whether it's the district attorney's office. So really trying to anticipate that there would be needs, even if we don't know exactly what those were yet. And then I think the second piece that is really important is that it's going to be really critical part of our success is going to be for us to be using the data. So using the data and using the information that's coming in about the impacts of people the best we can. And so that's one of the requirements for the grant application that we have to put into the state in any cases, how we're going to be using data, but also using that to help inform the decisions here. And then the partners continuing to stay at the table and be in conversation as we're learning about the impacts of the system so that we can be responding in the best way possible. Amy, I saw your note in the chat about starting night courts via video. I think night courts is something that has been talked about for a long time here, and potentially looking at the upside of doing that on impacts for people are important. So just wanted to reiterate the need to be flexible, the need to stay at the table and be in conversation, and the need to use data as we move forward with this. With that, Abby, I will turn it over to you to help facilitate some of the questions.
No problem. Thank you, Chair. Thank you. And thank you for answering those questions. Going in order of raised hand, first we've got Morgan, you're up.
Sorry, I couldn't find my mouse there. Okay, so under the ideal functioning of this, I want to know what would have happened to me in 2013 when I got a possession offense. Then it was drug court. And I was compliant with all the terms. I would show up to my groups. I ended up going through detox, inpatient, and relapsing. So while I kept attending my little check-ins, I was always giving positive UAs for heroin. And I ended up getting multiple jail sanctions, so 7-day, 14-day, and that is how I got fired. So the first time in my many year-long addiction, it was a jail sanction that got me fired, and then I became homeless. but I still engaged and was doing everything except stopping to use drugs. That just wasn't, I wasn't capable of that in that moment. And so I'm curious what would happen to me. Like, what is this procedure? I get dropped off at the place, I'm connected to treatment. But if people just continue to use while not engaging in criminal behavior, what happens to them? And then going to community supervision. So these are people that have essentially failed out of the deflection or opted against it, but then under community supervision, they're again just offered essentially the same treatment resources that they had been before, but this person has already demonstrated the fact that they are either unwilling at this time or incapable of stopping to use drugs. So then they're just violated and going to jail. I just want to know what would have happened to me.
Maybe Denise, do you want to start with the second half of that just briefly about what someone's in the community correction system?
Yes, I was waiting to see if we could go on the first half. So Morgan, the answer to your question, what we hope at DCJ is that you are going to be, or these individuals will be assigned to a field probation officer. So there's going to be regular contact. And here at DCJ, we use cognitive-based interventions and skill building, and to really help those folks that are pre-contemplative get to a place where they can help get on board with treatment being the best option for them. But as well as anybody that comes under DCJ supervision, we also look at what are the other needs that need to be addressed in order to get somebody to treatment. And so if it is, instability with housing, with employment, you need to address the person holistically and not just focus on the one issue that's outstanding. So from the community correction side.
But if they engage with treatment and then immediately relapse, they are going to eventually go to jail. Just to clarify.
Was it inpatient treatment or outpatient treatment?
I went to inpatient repeatedly and just kept relapsing the day I got out.
At DCJ, we have different options for sanctioning that's outside of jail. So jail is not the only option we have if somebody is in violation of their supervision.
And I would say on the pre-arrest pathway, so when we're talking about treatment readiness or deflection, there is a lot still to work out between now and September 1st. So we don't have all of the answers yet of what that framework will look like, but the intention is that somebody will get directly connected to services. They will get screened and assessed and connected to the services that they need. And if there is no other associated criminal behavior, that they will continually get connected to treatment. The difference is if there is other criminal behavior, then that person will be treated in the criminal justice system the way that they should be. But if it's that we're treating someone's addiction, the goal is that we will use that screening and that needs assessment to really make sure that people are connected to recovery services.
Fantastic. Thank you.
Awesome. Thanks, Morgan. Commissioner Gonzalez.
All right, thank you. I guess I just wanted to communicate my concerns about general launch thus far. We're seeing fairly harsh criticism from Rayfield State Legislature, the Oregonian Editorial Board, even DA-elect Vasquez. This is not a good launch for Multnomah County. And second, on substance, based on what we know about the plan, the perception that we have less structure than neighboring jurisdictions is concerning. The lack of accountability for users, at least as reported in the Oregonian, the low threshold for what success means, according to the Oregonian Editorial Board. I guess I'm just concerned as to how this has been launched, both from a process perspective, the lack of transparency and what is being articulated as the plan, and lack of inclusion of key stakeholders. Really would have liked to see more from law enforcement out of the gate on this. Truly, it's going to be Portland Police that are going to be implementing the front end of this funnel, and for them not to be fully on board with what's been communicated about the plan is problematic. I am glad to see that DA-elect Vasquez has been added. Thank you for expanding that net. But on substance, for us to deliver a program that's going to be less structured than neighboring jurisdictions is deeply problematic from my vantage point. So I'll leave it at that.
Chief Day or Chief Goldberg, do you want to speak briefly about kind of the process so far?
The process regarding, our meetings and so forth, getting to this point, is that what you're referring to?
Yeah, if you would be comfortable.
Yeah. So we met, I don't know when it was now. I don't remember what I had for breakfast, let alone the last meeting I had about this, but it was sometime in the last few weeks. And it was a smaller group, myself, the sheriff, chief of Gresham there, Mr. Goldberg, and I think DA Schmidt, et cetera, Judge Mazzarato was in there. And tried to come up with some kind of clear frameworks that we could start with, centering one around the idea of possession, that if it's just possession and that's all we have, that would be somebody who is eligible for deflection. So that was one of the key components. And then we talked about deflection. We talked about the deflection process, how many times somebody could deflect. And we agreed that at that point that there would be multiple times that a person would be able to deflect. And my thinking on that from a law enforcement standpoint was from a mental health addiction specialist standpoint, that's not my lane. So how many times a person deflects or how many times or what they respond to in terms of those services is really dependent upon what our subject matter experts say around that. The main key and I don't want to speak directly for Travis or Nicole so they can jump in. The main key from a law enforcement standpoint was the ability to interdict the behavior that's happening and then find an alternative so that we're not in the same boat we're in right now, which is where we just literally walk away. So we emphasize from a law enforcement standpoint that we wanted to have the opportunity. I fully expect that we'll be taking people into custody, handcuffing people, searching people incident to arrest, and then offering this deflection piece. So although we can characterize it as voluntary, it's not truly voluntary if you're in handcuffs, in my opinion, but we are going to make sure that that is available to individuals. And then where we go from there is to separate location or someplace that will abate the problem from where it is. And I think that's the law enforcement component to it. Once it gets handed off to, mental health or behavioral health specialists or addiction specialists in terms of strategies, built-in systems of accountability, et cetera, we have to defer to the county on that and their, best practices. But Travis or Nicole, did I say anything there that you can agree or disagree with?
I'll jump in real quickly. No, I 100% agree with you. I think the other thing that I would add is we've also been a participant in the work groups that Alicia has led in the, and we're very early on in that work. I think it's been said multiple times today that, it's really early on in this process and we don't have necessarily the data. We don't have everything figured out. I think it's also been said that things will likely change over the course of developing our deflection approach. So I feel comfortable and confident that we've been involved from a law enforcement perspective to give, every opportunity to give our 2 cents about where we need to be and where we need to go. So I appreciate those opportunities. And I think it's just, time will tell. I think I'll just give it from my perspective, as I often do. I represent what I feel, not only Gresham, but East County. And East County often is one of the last people at the table, so to speak, around the discussions. And we need to be reflective of that and understand that we have specific needs that may not always completely align with Multnomah County. But, we absolutely will use a drop-off center. We will absolutely, like Bob said, be arresting people and putting them in the handcuffs. But at the same time, we are all of us are committed to the deflection programs. And so my concern is just, making sure that we have the resources and support in place to make it all work and to ensure that we get the buy-in from our people in the field. And I'll let Sheriff speak. if she has anything to add.
Yeah, absolutely. Thank you. So all of our law enforcement partners are committed to some kind of deflection process. We, I think, can agree that just continuing to arrest our way out of a situation is not going to be the way out of an addiction and mental health crisis. As sheriff, obviously, community safety is my top priority. The addiction crisis is affecting everyone in our community, and I have concerns about the overall impacts to our community as a whole, continuing to be exposed potentially to criminal activity and drug use, as well as the person experiencing addiction who desperately requires and needs treatment. And so it's upon us to take action to really, we need to save lives. So I support a balanced approach, and there is places for off-ramps. However, I also want to ensure that I'm supporting the jurisdictions in my area in East County that endless deflection without any connection to services or meaningful connection to services, I don't believe is in alignment with the House bill or what our community expects. I am, again, I appreciate the collaboration and the partnership that we have all been at this table and working through this, and it is really early in the process, and time is ticking away very quickly, and I think we all recognize that. And ensuring that there's infrastructure, service providers, and resources. All of that, I think, is also dependent on how this deflection is rolled out. What is available with respect to ensuring people are meaningfully connecting to services, and having some accountability to this system as a whole. So I'll continue to be a partner and work with our leadership group, and committed to looking at ways to ensure that people are able to get the treatment and services that they desperately need.
Sheriff, thank you. And Chiefs, thank you for chiming in. Appreciate it. Commissioner Myron?
Hi, let's see. I'm trying to get my video on, but oh, there I am. So I want to echo some of what Commissioner Gonzalez had to say, but I didn't hear anything specific in the presentation at all, and I didn't hear any projections or estimates based on any sort of analyses, which could have been going on for months. But I'll try to ask just questions and can get the answers offline if there's not time. The first is, will people be required to go into treatment? And it's sort of to Morgan's question and her description of her experience, where it was like she was put in, it was like you're arrested and you're put in jail. Right now, we can leverage the criminal justice system to help facilitate getting people into treatment. But it's not clear whether that's going to happen here. Is treatment going to be sort of required in any way at any point?
I can jump in on that, Commissioner. Great question. At least on the beyond the deflection, if they make it through the court system and either get put on to us at DCJ for conditional discharge or the regular misdemeanor, it is an expectation that they will be referred, and it is an expectation that they attend and participate treatment. We will be working with our community justice stakeholders as to how do we define success to the point to where we would be allowed to both early terminate or earn discharge. That we need some more clarity on, but they will be required to be in treatment and participating to the hopes of successfully completing.
I guess I really appreciate that, Jay, and I note the DA Schmidt's point in the chat about that we can use the criminal justice system as leverage if there's treatment available and defense attorneys. And I would say, like, even for the number of people now who want treatment. We don't have nearly enough treatment beds available. And even more significantly, we don't have the long-term transitional recovery housing or permanent housing for them to move into when they're done with treatment or stabilization or whatever you want to call that short-term plan is. And so if they're just going to be going off the cliff after they go through the treatment door, and we've invested a ton of money in that, what is the plan to ensure people actually move through the system rather than just expanding the revolving door at great cost?
This is Judge Greenlook. Perhaps can I speak to this for just a second?
Yes. Thank you, Judge.
So as far as deflection is concerned, my understanding is that at this point, there's not a requirement that people participate in treatment. And perhaps that's because there is an understanding that there's not a lot of leverage to require it. If somebody's not ready to make changes, sometimes the best you can do is, offer resources to people. If the case ends up being referred to court and not deflected, then the person, first of all, has a right to have an attorney. And we don't have enough lawyers to appoint to all misdemeanor cases right now. Of course, it is of greatest frustration to watch people charged with significant felonies not get lawyers. But, we certainly don't, we have over 24 felony cases without lawyers a week coming into the system right now. And if all the cases, rather than being deflected, would come to the courthouse, most of them right now, the way things stand, and we don't know when OPDC is going to have enough lawyers. Right now, they're telling us they're working on a 6-year plan. We don't seem to have a 90-day plan. And so the vast majority of people would not get lawyers, which means that they would be told to come back to court to see if we had a lawyer for them later. The vast majority of those folks would fail to appear if they didn't fail to appear for the first time. If eventually they did come to court and eventually they did get a lawyer, talk about revolving door. We have people having to come back to court without lawyers 2, 3, 4 times. Some judges in our jurisdiction will dismiss cases after somebody's had to come back 4 times. If they ever do get a lawyer, they have a right to conditional discharge. The statute 4002 requires that in order to successfully complete conditional discharge, you not only have to participate in treatment, you have to complete treatment. We worked in a program called Treatment First for several years before the decriminalization from 110. And in that Treatment First program, there were people on felony possession charges back when they were a felony were offered conditional discharge if they would only engage in treatment. They didn't even have to complete. And we had an extremely low success rate, completion rate. Most people ended up doing jail time because they just, again, the coercive nature of in that posture does not sort of compel people to complete treatment who aren't inclined to do it and who don't have the support to do it.
So I need to, oh, I'm sorry, Judge. Do you have a
so it just ended up conditional discharge. Requiring treatment when somebody's looking at going to prison 3, 4, and 5 years, that works pretty well. It doesn't work pretty well in these misdemeanor contexts.
So we are over time. We were supposed to end 3 minutes ago. And so Commissioner Myron, if you want to write me your questions, however we can do that. I wanted to, before we close, give Commissioner Brima Edwards a chance to ask one question before we need to move on.
All right, I'll put it in the chat as well.
Thank you. So just to clarify, the connections that was stated on the goal slide, that being the goal of it, is that the only requirement? This is sort of a follow on to Commissioner Myron's question. That's one. And then the second, that presentation didn't say it, but it's been alluded to, the no limits on the number of times that somebody could be sort of go through the, be deflected. And Chief Day said that was not his lane. So my second question is the no limits, evidence-based, and was that a county health department decision? Who decided that that was, and is it evidence-based? So 3 just brief questions I think that we have.
So I'll answer the last question first, Commissioner. So the conversation is ongoing at the House Bill 4002 leadership table about what exactly the entire system is going to look like. In the conversation so far, there has not been a limit on the number of times people can go through, but I will say I don't know that we've actually spent a ton of time around that particular issue. I think what we heard from Chief Day is that when law enforcement was having the conversation about what equals deflection, they decided that they don't want to put a limit on it because that isn't their lane. So that is going to, we're meeting again on Wednesday. We're having continuous meetings. I do think that it needs to be based on the best practices from a health perspective, the best practices in terms of what actually was going to get us the outcomes that we want, which is that people being successfully on the pathway to recovery through treatment. And that's what's going to inform, I think, the decisions that go forward.
So even though it was broadly reported that there would be no limits, what you're saying is it's still under discussion. Just want to make sure
Yeah, I mean, so far we haven't put any limits on the number on people's ability to go through deflection, so they will, but we are continuing to still meet. Grant, I see your hand up if you want to jump in since you're at the table, if you wanted to speak to that, but I do want to, we are over time, so I just want to.
just answer to my other question too.
Yeah, and I'll just jump in really quick on that. I mean, I think we've heard numerous times today about the tremendous dearth of resources that we have in our community. And a lot of those resources are for these most high acuity users, the folks who will be cycling in and out. We do not have enough detox beds to get those people in. And detox is really the first step for those high acuity users. And to place a limit on that is to essentially say that once that person comes in, if we don't have those resources for them and they leave, and then they've lost their chance. And then we put them into the criminal system where, as Judge Greenlick just explained, they won't be getting any resources there. And so while it may seem like giving numerous chances, what it really is an approach based on a realistic assessment of resources and a firm understanding that addiction is a complicated issue that you cannot just address with a single incident, a single referral to treatment, that it takes time. And part of this is creating a connection and a relationship so that when that individual is ready for treatment, they know a safe place that they can go to get that treatment, assuming it is available. So I think that sort of answers sort of that last question of why unlimited. And I think part of it is this is a phased approach. And so it may not stay unlimited once there are sufficient resources available. But at this time, there just aren't.
So I'm sorry, just to clarify, you're saying it's unlimited, and that's from a public defender's standpoint, primarily because there's not enough detox or treatment resources. But if there were, there may be a different.
So I'm saying that is one of the bases, because if there are not resources available and that individual is deflected, then it's not really fair to consider that a deflection when that person didn't really have that opportunity to engage in services. But also someone may not be ready for services, and best practices of all deflection programs are not abstinence-based. They're not requiring treatment. And so, while there are programs that do require that, when you look at what the national best practices are for this, very few are abstinent or treatment require based. And so, what it is supposed to be is a community-based referral process for individuals who, once having a conversation with someone who's been in their situation, decide that they want treatment. And that's what is most effective for treatment long-term.
Yeah, of course. I mean, I totally agree. It's not fair to deny someone deflection if there's not detox or treatment resources available, but that's more than I think a critique of the system that's being set up versus of the specific individuals. So I'm thinking of unlimited in the context of there actually is detox and treatment available, because that's what actually how ballot measure 110 got set up. But I'm wondering if somebody else could answer the question, the original question I had, which is the only requirement that there be a connection made? And maybe this is a question for Alicia or the chair, because when I look at the goal slide, that's what it says, not that there be any particular activity that they're required to undergo.
I'm not sure what you mean by the goal slide, because I don't know that we had a goal slide. But what
it was that the goal was to connect individuals to treatment. And the goal was a connection, and I'm looking at the program objectives: connect individuals who would otherwise be arrested for possession of a controlled substance to a behavioral health pathway to recovery. So is the only requirement the connection, not that actually the individual undertakes some sort of activity?
That's right. We want the connection to be an opportunity to be connected with a screening, with services, and with opportunities for treatment and recovery.
And would those be required, or is it just here's the connection?
Yeah. No, it's the connection is the only thing that we're requiring at this point. So I know there's lots of questions. I see folks' hands up. I appreciate everybody's interest in this. We're going to continue to have this conversation. And, you know, this is obviously something that has a huge impact in our community. I will say for the work that is happening at the leadership table, the conversation that's happening within our community, and the further conversations that we're going to have in public, whether it's at our board meetings or in future LPSCC meetings, you know, this is obviously something that we are all very committed to, is making sure that we put a system in place that gives people the option that is not our justice system to find recovery, to find a pathway to health, that is using practices and is not just duplicating a system that wasn't working well before, which was just incarceration without access to treatment. But we do want to make sure that people are going to be held accountable for their actions and be accountable for themselves in having the opportunities for stability and for recovery. And so that is all about what we're doing today. I want to appreciate everybody who's been a part of this ongoing conversation. I want to appreciate all the folks who presented today on this information. And as I say, this is going to be an ongoing conversation, and it's going to be an ongoing system as we have something in place for September 1st, but are looking to really make sure that we have very real pathways and real options for people for recovery beyond September 1st. With that, I'm going to go ahead and end the meeting. Our next LPSCC meeting is July 22nd. I appreciate everyone's time. I see a lot of folks who had to jump off or are jumping off because of their next meeting, but appreciate the conversation today, and we will see you very soon. Thank you.
Thanks all.